Newsom Eye provides unique and personalized care for patients across the Tampa Bay area. And today, Dr. Newsom and Dr. El-Jabali are back to discuss how they can help with complicated cataracts. First, how are you guys today?
We're doing great,
Good.
Thanks for having us.
Well, we're excited you are here. We're excited that you are back.
Thank you.
And you're always tackling these topics that I've heard about, but I don't know a lot about. So first, cataracts. And I know you have a team approach that kind of helps your patients.
Well, our goal is to try and become the Mayo Clinic for eyes in the Tampa Bay area. That's where I trained at a lot of our stuff. And you have a lot of expertises in a lot of different areas at the Mayo Clinic, which makes you more comfortable taking on a lot more difficult cases. So for us, having myself that does LASIK and cataracts, another cataract surgeon on board, as well as our retina surgeon, who when everything is the most difficult, you have to have a quality retina surgeon. We've got a couple of retina doctors with us. We also have a glaucoma specialist that does glaucoma surgery, a corneal surgeon. So when you really start to get into patients that have complicated issues, they may need multiple surgeries, multiple doctors to look at them. With all of us under one roof together, we're able to really get a lot of difficult cases done and everybody working as a team.
So, Dr. El-Jabali, how does your retina area kind of help this whole cataract team, if you will?
So if we have complicated cases like Dr. Newsom just mentioned, we could kind of get all brains on deck how to tackle these cases. For example, you have something that has the retina involved, a lot of scar tissue in the back, along with a very dense cataract. So together we could kind of stage it and get an amazing outcome for the patient in the end.
And I'm kind of curious because, again, I'm new talking with you, and there's so many topics that I've heard about. Cataracts, heard about it, but when does a patient need to come and give you guys a call? Why are you guys the right fit?
Well, a lot of times for a normal routine cataract, their vision just gets a little bit blurry and they can't see. Maybe you can't pass your driver's test, can't drive at night as well. You've been followed, and it's finally time to have something surgical done. So a lot of patients come in to see us in that direction. But there's other patients that aren't seeing very well. Their vision's bad, and they've seen multiple doctors, and they say, there's really not much that we can do. We can't help you. This is a little bit too difficult. Well, that's kind of with my Mayo Clinic training. That's when you go to the Mayo Clinic. That's when we see patients or bring in a lot of those patients where we have the ability to take on those cases where someone might say, that's something that, you can't have done. Well, we don't say it's something you can't have done. We have to figure out a way to get that done.
And I'm assuming the patients love being able just to come to one place and be able to see multiple doctors, whatever their needs are. And I'm sure the feedback that you're receiving so far has been pretty positive.
It was amazing. I'm glad you brought that up. Yesterday we did surgery, had a lot of surgery, various retina surgery, glaucoma things going on, cataract surgeries at the same time. And these patients had surgery on one eye 2 weeks ago, kind of got to know each other a little bit, came back in, we did a lot of surgery yesterday. So they might have come from retina, glaucoma, cornea, different areas. They've all come together. And after surgery yesterday, they all had these amazing outcomes, and they all traded phone numbers and said, we're going to Applebee's. They're on Facebook. I mean, it really goes to show that they're getting amazing outcomes where they're coming, retina, cornea, glaucoma, all coming together. And it was just awesome for our staff and everybody to get that feedback.
Well, the big question, did you get the dinner invite?
I didn't get the dinner invite. But I said, if I would have known that, I would have gone by and I'd have bought everybody dinner and had that. It was excellent.
Well, just kind of getting back full circle, again, being able to provide that best care possible by having so many different specialties under your roof. It's got to be rewarding as a doctor as well.
It is. Our practice has really changed from just being a cataract specialty practice, which is what I do, to really trying to take on that sort of Mayo Clinic feel where you really have a lot or all of the specialties that you need and able to provide everything from A to Z for a patient and be able to tackle a lot of difficult things that I might not felt as comfortable with 5-10 years ago. With doctors like Dr. El-Jabali, Dr. Shrivastava, our other doctors that we can take on just about anything. Okay,
well, guys, appreciate your time coming in today and talking about it. And if you are interested in getting more information, well, just give them a call at the number on your screen or visit newsomeye.com.